Okay, sir. Am I audible now? The sponsors for our prize winners of the e-poster presentation and pharmacognosy e-quiz and plenary lecture is Dr. JRK Research and Pharmaceutical Private Limited. Ma'am, now I request Dr. JRK. Am I audible? Yeah, okay. Now I request Mrs. Amritavalli Research Associate of Dr. JRK Pharmaceutical Research Private Limited to give a felicitate of this gathering.
Hello, I'm Gayatri Rajgopal, Director of JRK's Research and Pharmaceuticals Private Limited.
Yes, ma'am.
Yeah, have you allowed Amritavalli inside?
Yes, ma'am. We have allowed her. Actually, she might be she's on call again. Simultaneously, it won't be accepted, ma'am.
Okay, shall I log out?
No, ma'am. I think she's on some other call and giving Google Meet login because we are all here only.
So, okay, I will just find out. I'll just find out why she's not able to. We are all able to log in so easily. Anyway, I'll find out just now.
Okay, ma'am.
Hello.
Hello.
Yeah, Amritavalli, time start is 2:30. That's what I'm informed. Maybe join.
Oh, it's 2:30. 1 minute. 2:30, is it?
No. Ma'am, actually, we have informed her.
2 o'clock, no?
Yes, ma'am. We have informed.
Yeah,
Okay.
that's right. 2 o'clock. Yeah, she's logging in.
Okay, thank you.
Yeah, she's logging in. Yeah, please hold on. She'll just join. Yeah, it'll be better. Might be you give her a welcome again. No, she's not yet joined. She's not able to join, no?
Okay, in that case, can we ask Madam to join at 2:30?
She's joined.
Fine. Okay.
Ma'am, shall I welcome now?
Yes,
Please.
Yes, please.
Good afternoon, one and all. The sponsors prize winners of e-poster presentation and pharmacognosy e-quiz and also plenary lecture, Dr. JRK Research and Pharmaceutical Private Limited. Now, I request Mrs. Amritavalli Ma'am, Research Associate of Dr. JRK's Pharmaceutical Research Private Limited, to give the felicitate.
Hello, ma'am. Good afternoon, everyone.
Yeah.
Good afternoon.
Good afternoon, Amrita. You're audible.
Yes, ma'am. So, I would like to present today one of our important product, immune modulator. Okay, so Yeah, I hope it is visible.
Yes, it's visible.
Yes. So, good afternoon, one and all again. And this is the immune modulator, one of the important product from Dr. Jarkis. And if you see the current scenario of COVID-19, so the one which is very much talked about is the immunity. See, if you see the people who is having a low immunity, or the people who is having the hypersensitivity or hyper immune responses, this is all leading to the death. So we will say that as a cytokine storm also. So in these conditions, but still we are talking about we need to boost our immunity. Why all these things? So before going into why we need to boost our immunity, when the COVID itself is actually enhancing or hyper reacting for the immune system, there is the greater number of immune responses is happening. That is one of the reasons for the death in many of the patients who is suffering from COVID-19. So but still we are talking about immune booster. So what is this immune modulator? Whether what actually the immunity is being modulated in such a way, so that will be helping the COVID patients to fight against the virus. And before we are going into this, our immune modulator, that is SIVA herbal drops, I would like to have a brief introduction of what are the kinds of immune system and where this particular product is actually stands and modulating the immunity. Okay, so if you see broadly, the immune system is classified as innate immunity and adaptive immunity. And innate immunity, if you see, that is a rapid response of our system towards the foreign particle or an antigen. If you see the system, it will be broadly divided into macrophages, which is the primary white blood cell. We will say this is the first cell, white blood cell, which will react to an antigen, and then it will respond to it, and then it will act effectively. And next are the natural killer cells, neutrophil cells, eosinophil cells, dendrite cells, T cells, natural killer T cells, and all these things are the innate immunity. Innate immunity is our own immune system which is present in us. And next is the adaptive immunity. Adaptive immunity is nothing but our immune response immunity will be developed based on the antigens. So once we got affected with certain kind of, for example, it is like measles or any kind of viruses, our body will generate the immunity against that further. So that kind of immunity is called as adaptive immunity. That is, a vaccine is also a kind of adaptive immunity, which is man-made. Okay, so this is the broadly two types of immune systems. And in adaptive immunity, antibodies, T cells, CD4 cells, CD8 T cells, all these things are very much important. And in innate immunity, macrophages, nothing but phagocyte cells, okay, which is the primary white blood cells, is one of the important, which plays a major role in the immune system of our body. Because once the innate immunity, and that too the basic, the primary cell which is functionally very active, that is the phagocyte cells, or if it is very active, the next immune responses will be very less. Okay, so we are now going to talk about what this immunity is happening, what is happening in COVID-19, what is immunity's role in COVID-19. If you see, in COVID-19, the cytokine storm is one of the important thing which is happening. It is an actually nothing but an acute hyper-inflammatory responses that may be responsible for critical illness in many conditions, including the viral infections, cancer, sepsis, or multi-organ failure. Okay, so actually our immune system, the phagocytes not able to handle the foreign article, foreign body or the antigen. The primary white blood cells is not able to handle because they might be functionally weak. Then our next thing is like inflammatory responses will be taking place, our secondary immune responses. But what will happen in COVID is that immune responses are too high that our body itself is getting damaged because of it, and then it is leading to the death conditions, multi-organ failure, and also like severe sepsis and all those things. Okay, so this is very much important here. Our first the primary immune system should be very strong. Okay, so that is one of the important thing this current product will be helping us. Okay, and phagocyte mediated immunity, that is the macrophages, the primary cells, what it will do actually, if you see, these will be binding to the antigen, and then it will lyse it and then reduce its effectiveness, and then it will lead to, it will dissolve the debris and all those things. And if here this particular process is not active, then it will signal the inflammatory inflammatory reactions, nothing but the cytokines, and that will leads to the cytokine storm, and that is what is happening with the COVID-19, because some of the people's phagocyte cells or the primary white blood cells are not so active, because of which that may leads to the cytokine storm. Okay, so and here I'm introducing you the SIVA herbal drops, which is an immune modulator. Okay, which is a modulator for chronic autoimmune disorders, and also for the which is very much helpful in these viral infections or recurrent infections, any kind of infections, or like in any autoimmune disorders. This will help in modulating our immune system in such a way that it will boost our phagocyte mediated immunity. So once our primary defense system is very strong, our affective it will affecting of the other immune responses or immune reactions very less. That is like psoriasis, or like where the inflammatory responses is very high, like arthritis, or like COVID situations, like where you have a cytokine storm and all those conditions. This product will help in reducing the secondary immune responses by boosting the phagocyte mediated immunity. Okay, the phagocytes are the primary defense mechanism of our body, and SIVA herbal drops will boost that and improve its functionality of phagocytes. Therefore, the secondary immune reactions is not at all required. Okay, and if you see this, what this product will do, it will enhance the phagocytosis process. The phagocytosis is nothing but a process where the antigen is being engulfed by the phagocyte cells, and then it will dissolve these antigens, and also it boosts the immunity. That is, the immunity is nothing but here it will enhance the phagocytosis process, that will boost our immunity. And next is it will enhance the phagocytic ability in hypoxic conditions. Also, we have done a study recently also on this particular product in hypoxic conditions. Hypoxic conditions is nothing but low oxygen levels. So when our cells is getting infected and there is low oxygen content, generally our body responses will be, and our functioning of the phagocytes will be very less. But SIVA herbal drops will help in enhancing the phagocytic ability even in the hypoxic conditions. So that is a plus point over here that will be helpful in COVID situations also. Like it will help in boosting our phagocytis mediated immunity, even in the hypoxic, means low oxygen level contents also. Okay, and next, because of this, it will also controls the recurrence of autoimmune disorders like psoriasis, vitiligo, and arthritis, and all those conditions where the inflammation or the secondary immune responses is very high. Okay, and the benefits of the first line of immunity or first line of defense is, as I already told, it will help in reducing the inflammatory reactions. And the myeloperoxidase is one of the enzyme which is very high in inflammatory situations, that leads to comorbidities also, and that also will be reduced when you are taking the SIVA herbal drops on regular basis. And also it enhances the functionality of the phagocytes even in the hypoxic conditions. Therefore, the secondary inflammatory responses or the secondary immune responses will be reduced. Okay, and we also have done a lot of studies, preclinical as well as in vitro conditions. Okay, as well as we have few clinical trials also we have done on this particular SIVA herbal drops, to understand whether this product will reduce the will reduce the infections. And also we have tested how it is boosting the phagocyte mediated immunity. And in the preclinical studies, what we have done earlier, we've seen that the phagocytes which are treated with SIVA herbal drops, there has no mortality rate at all. No mortality means there is no death at all when challenged with the candida. As well as we also verified for its histopathologic reactions, and there is no damage of any of the liver cells or the lung tissues when we are treating with SIVA herbal drops. Whereas in the control, means non-treated one, there is a lot of tissue damage which leads to the secondary immune responses. Okay. And also we have done the phagocytosis assay, how much percentage it is actually enhancing the phagocytosis process. If you see, it is 134% improvement in the phagocytosis process has been observed when the phagocyte cells are treated with SIVA herbal drops. Okay, so which is a very much higher percentage for the cells to function well, and it is a natural immune booster. Okay, and in vitro studies, what we have done on the myeloperoxidase enzyme, which is an immune uh, which is an immune response triggering, that is inflammatory response triggering enzyme, okay, which will be released in the cells to kill the bacterial pathogens or anything, any antigens, and this will be very high when there is an infection or anything or inflammation, and this will also be reduced and modulated in such a way that it won't affect. Okay, and what it contains, if you and this is the benefits of SIVA herbal drops. It is a combination of Sivanar Vembu, Valulubai, Akasa Garudan, Karpuram, and Thuduvalai, and this is present in the base of gingerly oil, which is well known for its. All these herbs are well documented for its immune boosting activity and immune modulation benefit, and it will what this product will actually do is it will enhance our first primary defense mechanism. Therefore, there will not be any secondary immune responses which will negatively affect our system. Okay, and this is present in a base of gingerly oil, and the usage is like you need to 10 drops twice a day in the empty stomach, and for children it is 5 drops twice a day in the empty stomach. Okay, so this can be taken on regular basis, so that the boosted immunity will be present, and the comorbidities effectiveness of other comorbidities also will reduce, and also the any patient who is having the chronic infectious conditions or autoimmune disorders or like hypoxic conditions, this will be very much helpful, and it will for the normal people also, they can take it on regular basis to have a primary defense mechanism, to have a better primary defense mechanism. Therefore, their occurrence of infections and all also will be very less. And we have done also some of the clinical trials where SIVA herbal drops plus topical 777, Dr. Jarkis 777 oil we have done. This is a clinical trial where we have seen when you are treating with SIVA herbal drops, there is a lot of reduction in the inflammatory conditions, and the patient got clearance in his skin conditions. Okay, psoriasis is an autoimmune disorder where the inflammation scaling will be there. And for that, Dr. Jarkis 777 oil will be given. And along with that, when SIVA drops has been given, the patient has recovered very fast, and the inflammatory responses also has subsided very fast. Okay, and this is, and also we have done a clinical trial on chronic fungal infections patients also in Apollo, where we have seen that SIVA treated people along with their regular conventional medication, they have a very fast recovery compared to only conventional medication. Okay, so all together, and we have done all these publications, and we have published all our studies in the international and the national journals. Okay, which defines the basic of mechanism of activity of this SIVA drops, and how it effectively controls fungal infections, autoimmune disorders like psoriasis, and in how it is effective in hypoxic conditions, and all those studies has been published in various journals. Okay, and this is scientifically and clinically proven to be effective to boost the primary defense mechanism of the. Okay, so thank you all for this great opportunity.
Anchor, please take over. Organizing committee, we thank you very much for this nice presentation. Thank you.
Thank you.
Thank you so much. Thank you so much.
We will adjourn for lunch, and we will have a very quick lunch and join back at 2:30 p.m. Thank you very much, all the participants.